Today on Health and Wellness Show, we are speaking on how smoking affects heart health. I'm Sharon Chang, and with me is Dr. Yeong, consultant cardiologist at Columbia Asia Hospital, Setapak. Welcome to the show, Dr. Yeong.
Thank you for having me, Sharon.
Dr. Yeong, we always hear about the dangers of smoking and what it does to the human body and the multiple diseases it brings. So can you share on average how many % of heart disease cases are caused by smoking? And can you also share with us what is the reason behind that?
Okay, so today our topic is about smoking. Okay, so we're going to talk about this small little evil cigarette. Okay, so there's some slide that I would like to share with you all, so to hopefully can enlighten you all about how dangerous about smoking. All right, so this small little evil, the cigarette, it actually introduced not only nicotine, but also more than 5,000 chemicals, including numerous carcinogens. What is carcinogen? It's basically cancer-causing chemicals into our organs, into our body. So it can affect not only the heart or lung, it also can affect the brain. It will increase the risk of stroke for 50%. Of course, the main organ damage is lungs. It causes 84% of death from lung cancer and 83% of death from obstructive airway disease, and increase 30% of risk of heart disease. Not only that, it causes several types of cancer in mouth, throat, to stomach, and pancreas. It also can cause infertility to men and women. It will cause our bone become more fragile, and most important for the female, it will cause premature age to the skin by between 10 to 20 years. So what happens when we smoke? Normally, when you breathe in air, fresh air, the lungs will take the oxygen and deliver it to the heart, and subsequently pump the oxygen-rich blood to the rest of our body. But when we take a cigarette, we breathe in the cigarette smoke, the blood that is distributed to the rest of the body become contaminated with the smoke chemical. This chemical can damage to your heart and blood vessel. Cigarette smoke can also changing your blood chemistry and causing arteriosclerosis. Arteriosclerosis means building up a plug in the artery. What is a plug?
So, Dr. Yeong, sorry to interrupt, but is there another layman term for arteriosclerosis?
Yeah, so arteriosclerosis, it means building up the plug. So what is a plug? Plug means a waxing substance comprised of cholesterol, scar tissue, calcium fat. So I will show you in animations for a better understanding. So this is our blood vessel. When it's healthy, it's round and patent. The space are adequate for blood to go pass through with oxygenated rich red blood cell. So as the time goes by, after the blood vessel exposure to the chemical substance in the cigarette smoke, the plug will build up. This is basically what happened throughout the time, and eventually the blood vessel will become narrow. So the chemical of the smoke also will rise our blood pressure. It also will increase our heart rate, and it will reduce our blood flow to the heart by narrowing the blood vessel, and also make our blood become more sticky. And because of the carbon monoxide that we breathe in during the smoking, the carbon monoxide will reduce the amount of oxygen and because of the blood become more sticky now, and the blood vessel are narrow, it tends to form clot inside the blood vessel. This will ultimately cause heart attack or stroke. And the chemical of the smoke will damage our blood vessel structure. Smoke also will bring down our good cholesterol and increase our bad cholesterol. All these effects will increase the risk of stroke by twofold. And furthermore, smoking also linked to depression and stress. So what is cardiovascular disease? Basically, it's an umbrella term of all the disease affecting our heart and blood vessel. So smoking is the main cause of cardiovascular disease. So this group of disease including coronary heart disease, also family known as heart attack, hypertension, high blood pressure, stroke, and abnormal dilation of blood vessel, also known as aneurysm. Peripheral artery disease means disease over the artery in our limbs. Do you know that 1 out of every 5 smoking-related deaths is caused by heart disease in Malaysia? And in Malaysia, cigarette smokers are 2 to 4 times more likely to get heart disease than a non-smoker. And again, I have to stress again, cigarette smoking will increase the risk of stroke by twofold. Women more than age of 35 who are smoking and also take birth control pill are much higher risk to get a heart disease or stroke compared to a similar age man. And how bad does it affect our country? So this graph basically summarizes the 5 principal causes of death in Malaysia in year 2018. These are the top 5 killer in our country. Number 1 is heart disease. Number 2 is infection to the lung. Number 3 is stroke. Number 4 only is car accident. Number 5 is airway disease. So among these 5 conditions, 3 of them are related to smoking. Just by heart disease alone, it kills 50% per day on average. And who are they? They are people who are aged 41 years and above. So basically, those aged 41 years and above are the person, are the sole breadwinner of family, are the management level of a company, are the leader of the country. That's how smoking can jeopardize our social economy and increase our burden to our health system.
Dr. Ng, I mean, you mentioned all the dangers of smoking, but if someone who is a smoker, but he exercises and follows a healthy diet, eating nutritious food, will the smoking habit reverse the benefits of exercising and a good diet too?
Unfortunately, it is not. So, because smoking itself is an independent risk for all these problems. So, by doing other healthy lifestyle or eating clean, it does not counter effect of the damage from the smoking habit. In fact, the damages or the chemical that remain in our body is by accumulating. So is over the years, over the amount of smoking that you had previously.
So Dr. Ng, some would say that, okay, I'm just a social smoker or so-called light smoker. So is social smoking less harmful compared to someone who is actually a chain smoker?
Unfortunately, there is no true social smoker. If you are a social smoker, you probably also were exposed to a person who are smoking. And this will introduce you to passive smoking. And being a social smoker or being a passive smoker, the chemical of cigarette smoke will still continue accumulate in our body and causing damage. There's no clear study to show that what are the main difference. But just passive smoking itself is proven that the risk of getting a heart disease or risk of getting a cancer are similar to a regular smoker.
Dr. Ng, tobacco manufacturers, right? They carry different variants of cigarettes. Maybe it's marketing kind of sale. So, but what is the difference? Are the cigarettes labeled light or filtered, less harmful than the regular cigarettes?
No, all of them are the same. So those are filtered or light. They might have filtered out some of the dangerous substance like tar and other carcinogen, but it's not all. So there will be no different if you taken a filter cigarette or this one. The harmful damage will still occur. In fact, WHO are still studying on how to make a regulation to reduce nicotine content in every cigarette, set it to a lower concentration during manufacturing. But we are still wait for WHO to come out a latest guideline about that.
What about vaping, Dr. Ng?
Okay, vaping. Okay, let me share something about vaping. And it is a trend for society nowadays, and in fact, it possesses a lot of a dangerous point towards our population because it has exposed to a younger generation, and vaping's device are getting smaller, more handy, more convenient, and some of them even mimic a pencil. So it make the teenagers, the younger age, started to cigarette smoking habit much earlier than before. So let me share something about vaping. So vaping, it actually deliver more concentrated nicotine than cigarette in a smokeless inhaled mist. And the health risks from a vaping product range from asthma to chronic obstructive pulmonary disease and even cancer. E-cigarette vapor also contain other damaging substance. Inhaling this kind of non-nicotine vape ingredients may cause severe, sometimes deadly lung damage. This condition is called EVALI, EVALI. How about others tobacco products like cigar or smokeless tobacco product? They are no different from regular smoking. Cigar smoker face many of the same potential risks as cigarette smoker, including cancer. And chewing tobacco or smokeless tobacco products are not safer than cigarette. Smokeless tobacco contain almost 30 types of cancer-causing cancer. This show that vaping is not a good idea. In fact, it is a monster that we create. The damage of our heart and lungs yet to know. So there are more and more study and more case up this day to show that the dangers of vaping.
Okay. So, but research over the years, over the past 25 years, has shown out of 100 people trying to quit smoking cold turkey, only about 3 to 5 of them will succeed for longer than 6 months. So in other words, while some people can quit this way, at least 95% of people cannot. So that's a very high percentage. So in your opinion, why is that so, Dr. Ng?
Not entirely true. Cold turkey way of smoking cessation is still one of a good way to do it. Of course, there's no definitely plan for everyone. So there's no one treatment for all the people. So everyone have to plan their own smoking cessation program according to their personality, their daily lifestyle, and how they cope with it. So cold turkey is one of it. So there is a study done in 2015 in England. They involve about 700 people, and they separate into two groups. One group they were asked to stop smoking abruptly. Another group were asked to stop gradually. But both are given nicotine replacement, chewing gum, and patch until the day they quit smoking. So in the group of stopping abruptly, are more successful. Actually, is almost achieved 40 to 50% of smoking cessation compared to a gradual one. So it actually shows over a month, the group of stopping abruptly are more effective than those stopping gradually. So I do not force my patient to choose or follow the way I am. But if they are started with smoking abstinence for a while, then I will encourage them to continue as long as they can last. And surprisingly, most of them actually they can just quit smoking by that. So why I do that? Because most of them I catch them in the ward. So they probably was warded for 3 to 4 days, and no chance they'll get the time for smoking. So, and I'll just continue to encourage them to quit smoking until they really cannot take it. And then surprisingly, a lot of them actually successfully quit smoking by this kind of method.
So if you quit immediately, what would happen to your body?
Well, there will be no harm to our body. There's a lot of myths say that it's not healthy, you stop immediately. Actually, no. If you stop as soon as possible, the benefit will be better. Okay. So what are the harm that they worry is actually the withdrawal symptoms, with the withdrawal from the nicotine. So the symptoms actually can happen as fast as 30 minutes from your last cigarette. So the people will start feeling a bit lightheadedness, a bit headache, but usually it's very mild. And some of them will, over the days, they'll feel a bit weak, because smoking is a stimulant. You make people feel awake, you make people feel good. So stopping it when the nicotine depleted, of course, people will feel weak or less concentration to the thing that they focus. And also people will start to gain appetite and gain weight. But the weight gaining is around 2 to 5 kilogram over the month. I think all this can be countered by adjust the lifestyle. So I always encourage my patient, if you plan to start smoking, you must understand the nicotine withdrawal symptoms. You must understand the problem you're going to face, and you must have preparation, have mentally and physically for it. You must have enough rest, have a good support from your family, and well plan the program, tailor it according to your lifestyle, and make it as sustainable as possible.
So does weight gain happens to all smokers who want to quit smoking?
It's common.
That's one of the some side effects of quitting smoking or something.
Well, you can say it's side effect, or you can say it's a good effect, because actually is the process that your body make yourself more healthy. Because when you quit smoking, your appetite will come back, and also your sensation to taste and smell will be back to normal. So everything you eat, you smell is more delicious now. So you tend to eat more.
See. So, okay, Dr. Ng, so if just say I have quit smoking and roughly around maybe about a year, you know, so, or half a year, would my health condition be the same as a non-smoker?
Okay, so I'm going to share again with the slides. So there's a lot of benefit on stopping smoking, and the benefit will come as soon as we stop the smoking immediately. Okay, let me share something with you. So the benefit of smoking come immediately after we stop smoking. So it will immediately reduce the pollution to the environment, and most importantly, it immediately save your money. So after 20 minutes to 1 hour, we stop smoking, the heart rate drops to normal, and blood pressure begins to drop, and circulation may start to improve. After 12 hours, the carbon monoxide level returns to normal, means that the oxygen had higher chance to bind to the red cell and distributed to our body. Our oxygen level in our body will start to increase. After 1 day of quit smoking, the risk of heart attack begins to decrease just by 1 day. The blood pressure begins to normalize. The heart rate become to get a decreasing trend, and the risk of heart disease will also decrease. Oxygen level in the body will rise, making physical activity and exercise easier to do. After 2 days, smoking damage to a nerve ending responsible to sense and smell will improve, and this make we are more sensitive to smell and sense again, and will increase our appetite. And after 2 days, our endurance to physical activity will also increase. After 3 days of stopping smoking, the nicotine level in the person are depleted. And this is a time, after 3 days, this is a time that most of people will experience withdrawal symptoms. So after at the 3rd day, we should anticipate it and adjust accordingly. It probably will help us to overcome the addiction. After 1 month, our lung function begins to improve as the lung heal by itself and lung capacity improve. Former smoker may notice less coughing, less shortness of breath, and the athletic endurance continue to improve. After 9 months, the lung is significantly healed by themselves, and there's a less chance of lung infection because a healed lung system, it will start to do their job and can expel the pathogen, the microorganism more effectively. After 1 year quit smoking, a person's risk of getting heart disease decreased by 50%. After 5 years, the body has healed itself enough for the artery and blood vessel to begin widen again. The widened blood vessel will less likely to be clogged, and the risk of stroke and heart attack is reducing. The risk of stroke will continue to decrease over the next 10 years. After 10 years of quit smoking, chance of getting a lung cancer are cut into half compared to a person continue smoking. The likelihood of getting a oral throat pancreatic cancer also significantly reduced after 10 years. After 15 years of quit smoking, the risk of getting coronary heart disease is equivalent to a non-smoker. The risk of getting a pancreatic cancer will reduce the same as non-smoker. After 20 years of quit smoking, the risk of death from cigarette-related disease cause including lung cancer, lung disease, and pancreatic cancer will drop to the person who never smoked before.
So in your practice, I'm sure you have come across many patients, right, who have quit smoking, but they experience a relapse. So what is the reason and what's your advice to them?
Okay, it is not uncommon to be relapse because those people are facing main two obstacles. Number one is the addiction. Number two is a habit. So these two things are the most difficult thing to do. So first of all, we shouldn't be stigmatized or penalize those who fail smoking. Instead, we should encourage them to try again. Maybe look back to what is lacking in the program, and then offer them more assistance. This will definitely increase the chances of quit smoking. So many of them actually cannot withstand the withdrawal symptoms, and a lot of misbelief. They think that is they are getting weaker, not healthy because of stop smoking, and also wrong information from the friends who are majority are smoker who doesn't want to quit. So the influence are negative to them.
So it's like
So
peer pressure. Yeah.
Definitely. So usually those are, and of course, a wrong strategy for quit smoking.
So Dr. Ng, I understand that Columbia Asia Setapak has a quit smoking program. Can you maybe share about something about this program to our audiences?
Yeah, our team, our doctors, associated with helping people to quit smoking. We have the counselor to counsel people and help them to adjust their life, adjust the lifestyle during quit smoking, and we also provide help with medication from nicotine replacement therapy, which is chewing gums and patch, all that, to medication that help them to stop smoking. We do have that. So the team is actually consists of doctors, counselor, and also pharmacists.
So, lastly, Dr. Ng, is there anything further you wish to share with the audiences?
Yeah, maybe during this pandemic, does smoking whether do good or bad for the whole environment? Actually, you'll be surprised that this pandemic, this lockdown, actually provide a lot a good timing for a lot of smoker to think again whether they should stop smoking, and the rate of this group of people stopping attempt to stop smoking and successfully stop smoking are getting better. So this probably a good part of this pandemic that hopefully once it's over, getting more and more people quit smoking and become healthier.
Thank you, Dr. Ng, for taking the time to be on our show. I have been speaking to Dr. Yeong, consultant cardiologist at Columbia Asia Hospital, Setapak. This video will be on our Facebook and LinkedIn site, as well as on our website, www.biztech.asia. Please check out our website for business and technology conversations via articles, videos, and podcasts, and subscribe and like our Facebook and LinkedIn pages.